Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Hip Spica Cast. Introduction. Babies and children with hip problems may need a hip spica cast to keep their lower body and hip in alignment for a period of time. This program explains why your child needs a hip spica cast and how to care for your child at home. Anatomy. The hip joint is a ball and socket joint. The femur is the large bone of the upper leg. The head of the femur is the ball part of the hip joint. Just above the femur is the pelvic bone. The round edge of the pelvic bone that fits together with the femur is called the acetabulum. This is the socket part of the hip joint. Reasons for hip spica casting. Sometimes a baby's hip socket doesn't develop properly and the hip may not join properly with the pelvis. This is known as developmental dysplasia of the hip, or DDH. If severe cases of DDH are not treated, they can cause problems in young adults with walking and hip arthritis. Surgical treatment for DDH could include closed reduction, open reduction, acetabuloplasty. To keep the hip in the right position as it heals after surgery, healthcare providers use a lower body cast called a hip spica cast. A hip spica cast can also be used to treat a broken femur bone or to treat hip problems caused by cerebral palsy or Perthes disease. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Types of hip spica casts. There are a few different types of hip spica casts. 1. A short hip spica cast covers the upper legs and hips. 2. Long leg hip spica casts cover both legs completely. 3. Some hip spica casts cover only one leg completely. 4. Other hip spica casts cover one leg completely and the upper part of the other leg. Some hip spica casts have a crossbar between the legs for added support. Transportation. To keep children in a hip spica cast safe during car rides, they may need a special car seat or harness. Talk with your healthcare team about your transportation options before they place the cast. The right seat or harness depends on your child's age, weight, and type of cast. Your healthcare team can help you determine if there is a car seat option that works for your child. Older children may lay down across the back seat in a special harness or vest. Use a stroller, wheelchair, or wagon to take your child around the house. Your healthcare team will help you pick the best option based on your child's age and weight. When transporting your child, make sure the edges of the cast don't dig into their skin. This can cause pain and skin sores. Positioning. Your healthcare team will show you how to safely lift your child. If the cast has a crossbar connecting the legs, do not use the crossbar to lift or turn your child because it may break. Do not lift your child by their underarms. This can cause discomfort and problems with healing. When lifting, support your child's back and bottom. Hold your child close to your body. Your child can lie on their side, back, or tummy. Place your child with their head and upper body elevated when possible. This allows for better positioning of the hips down in the cast and allows gravity to pull urine, pee, and stool, poop, away from the cast. In the hospital, your child may have their legs elevated to help reduce swelling and provide comfort. Make sure their heels and toes don't rub against the fabric. You may notice red skin around the top or bottom of your child's spine. If so, your child should spend more time on their tummy to allow the skin to heal. Your child can also sit upright in a comfortable chair. Beanbag chairs placed against a wall work well. Change your child's position every 2 to 4 hours during the daytime and at night. With each position change, make sure the edges of the cast aren't digging into your child's skin. Ask your child's healthcare provider whether your child can put any weight on the cast, walk around, or crawl. Toileting, bathing, and dressing. You may notice bruising and swelling around your child's privates if your child had surgery. This is normal. An ice pack wrapped in a clean, dry towel can help reduce discomfort. You must use incontinence pads over the open area of the cast to absorb urine. Gently tuck the edges of the pad into the front, back, and sides of the cast. Then place a regular diaper on top of the cast. Change the pad and diaper as soon as your child urinates or has a bowel movement. Check the pad every 2 hours during the day and every 3 hours at night. Older children may use the toilet or a bedpan and urinal. While using the toilet, bedpan, or urinal, keep your child's head up to keep the cast dry. When your child's skin gets dirty or wet, give your child a sponge bath using a washcloth, mild soap, and warm water. Be careful not to get the cast wet. Wash your child's hair over the sink or bathtub with mild shampoo and a water jug. You will need another person to support your child while you wash their hair. Young children and babies can usually wear their regular clothing outside. Older children's clothing may not fit over the cast. You can cut the sides of their pants and use Velcro strips to make them bigger. If the cast has a support bar, cut and place Velcro on the inside of the legs. Cast care. To prevent skin infections and breakdown of the cast material, keep the cast and your child's skin dry. No showers, swimming, or tub baths are allowed. If the cast gets wet, use a hairdryer on the cool setting to dry it. Do not use the warm or hot setting on the hairdryer because this can burn your child's skin. The cast may get urine or stool on it. Waterproof tape has been placed around the edge of the cast to help with this. If the cast or tape becomes soiled, clean it with a damp washcloth and a mild detergent. Remove crumbs or stool from the skin under the edges of the cast with a damp washcloth. Don't use lotions, oils, or powders on the skin around the cast. These can make skin sores more likely. Do not remove the padding inside the cast. When to call your child's healthcare provider. Medication can help reduce your child's pain and muscle spasms at home. If your child still feels pain after taking pain medicine, contact your child's healthcare provider. Check your child's toes and the skin around the edges of their cast every day. Look for swelling or changes in color or temperature. A flashlight can help you see better. If your child has cold, blue, or tingling toes, call your child's healthcare provider. Also call if your child cannot move or feel one of their toes. This may mean that not enough blood is reaching the toes, or there is pressure on the nerves in the legs and the cast is too tight. Large meals can make the cast too tight around your child's tummy. To prevent this, give your child small meals often. If the cast seems too tight before meals, contact your child's healthcare provider. Don't let your child put any objects, such as coins or toys, inside the cast. This can damage your child's skin and lead to an infection. Call your child's healthcare provider if you see something inside the cast and you cannot take it out safely. Do not let your child use an object to scratch skin inside the cast. To relieve the itch, Gently tap on the cast or blow air over the itchy area with a hairdryer set on cool. The cast may smell a little like urine or stool. This is normal. Contact your child's healthcare provider if you notice a strong, foul odor coming from the cast. Call your child's healthcare provider if you notice any cracks or softening in the cast. Call your child's healthcare provider right away if your child has trouble breathing. You should also contact your child's healthcare provider if your child has a fever or chills, seems more fussy or irritable than normal, has diarrhea or constipation. Fruits and vegetables can help prevent constipation. Has a rash, sore, blister, or other skin problem. Complains of rubbing or burning skin.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Babies and children with hip problems may need a hip spica cast to keep their lower body and hip in alignment for a period of time. To keep children in a hip spica cast safe during car rides, they may need a special car seat or harness. Talk about your transportation options with your healthcare team before they place the cast. Your healthcare team will show you how to safely lift your child. Do not use the crossbar to lift or turn your child because it may break. Do not lift your child by their underarms. This can cause discomfort and problems with healing. Change your child's position every 2 to 4 hours during the daytime and at night. With each position change, make sure the edges of the cast aren't digging into your child's skin. You must use incontinence pads over the open area of the cast to absorb urine. Gently tuck the edges of the pad into the front, back, and sides of the cast. Then place a regular diaper on top of the cast. Check your child's toes and the skin around the edges of their cast every day. Look for swelling or changes in color or temperature. A flashlight can help you see better. Contact your child's healthcare provider if your child has a fever or chills, seems more fussy or irritable than normal, has diarrhea or constipation. Fruits and vegetables can help prevent constipation. Has a rash, sore, blister, or other skin problems. Complains of rubbing or burning skin.
Thank you for using Explain.